Hello, my name is Jennifer Moore, and I have been a home health aide for the past 6 years. I have a passion for working with patients, especially those within the hospice population. I'm going to be talking to you today about what hospice is and how Americans can have a better end-of-life experience. Whenever you are asked, how do you want to die? The typical answer that I hear is at home, surrounded by loved ones. 85% of Americans agree and want to die at home. Unfortunately, only 25% do. The other 75% usually die in a hospital, hooked up to tubes, wires, and breathing machines, being poked and prodded with needles, and might emerge with a rib crack or two if they need to be resuscitated. Unfortunately, it doesn't have to end this way. In terms of hospice, we call this a bad death. It might sound like an oxymoron, but alternatively, there is such a thing as a good death too. A good death is one where the patient is comfortable at home, at peace with their family, and a dedicated care team at their side. Now, how can Americans die better? That is through a hospice care agency, or end-of-life care agency. What is hospice exactly? Hospice is care for an individual with a terminal illness who has approximately 6 months expected left. What does a hospice care team look like? With Amedisys Hospice, this is what their care team looks like. Specific services can vary between agencies and can include aromatherapy, massage therapy, pet therapy, music therapy, and a lot more. Hospice care is not just for the clinical or medical needs of a patient. Hospice is about providing comfort care to an individual and to meet their social, emotional, mental, spiritual, and physical needs. This is meant for the family as well. This allows for healthcare professionals to take on the burden of caregiving off of family members and allows them to be a son, daughter, and granddaughter to the patient as they respectively are. There are many myths and misconceptions about hospice care, and I wanted to go over a few of them with you today. You're just going to dope up my family member. Hospice is about holistic care and making sure that a patient is comfortable, and it prevents hospital visits. So it's not just about drugs or clinical needs, it takes care of the whole patient. Another one that I hear is hospice is synonymous with death. Hospice care cannot and will not accelerate the death process. In fact, patients who are on hospice live on average 21 days longer than patients who do not use these services. Now, how does a patient get on hospice? Although it does require a 6-month life expectancy, you do not have to wait for a doctor to prescribe hospice care. The process is simple. You can contact your local hospice agency and talk to them about if these services are right for you and your family. Enrollment can be gone over with a social worker. Hospice care services are provided at no additional cost, as they are a Medicaid benefit which is paid for through taxes. My personal experience with hospice. My grandmother was enrolled in hospice when I was 19 years old, and I did not know what was going on within my own home. Many people were coming in and out of the house that I did not know. I knew that they were giving her morphine, and within months, she was gone. My family was not educated on the hospice process, and we went with the first agency that we found. I was not satisfied with my personal hospice experience, and I wanted to educate you all to avoid making the mistake that my family made. And this is a picture of me and my grandmother when I graduated in high school 1 year before she passed away. I understand that death is an uncomfortable topic to discuss. However, we all know someone who is aging, and we will all become old one day too. By spreading awareness and educating others about hospice, we can help Americans have a better and more positive end-of-life experience. One of the local hospice agencies that I frequently get in touch with has a What Matters Most program, in which they ask patients what matters most to them. Some say seeing a relative they have lost contact with, while others want to stay alive as long as possible, and others want to be baptized. Each patient's wishes are taken into consideration, and through their care team, many patient wishes are fulfilled. Death does not have to be a negative or terribly saddening experience for a patient, and hospice can help them mend bridges and to make sure that their affairs are in order to ensure a peaceful and comfortable journey. Many agencies offer a 13-month post-mortem bereavement support program so that a family can be supported after the family member dies. I hope that you all learned something or can take something away from this presentation. If you or someone you know would benefit from hospice services, please contact your local hospice agency. Thank you for listening.